Welcome to Common Sense Wellness with Dr. Gary Martin, the show that helps you take control of your health with clarity, confidence, and practical wisdom. Dr. Gary Martin has spent decades in clinical practice and natural wellness research, discovering that the key to lifelong vitality lies in understanding the body's signals before they become symptoms. Each week, we will explore simple science-backed methods like mineral testing, facial scans, and lifestyle adjustments that help you restore balance from the inside out. You'll also hear from expert guests and real clients who have turned their health challenges into stories of transformation. No gimmicks, no fads, just common sense wellness that works. Now, here's your host, Dr. Gary Martin.
Okay, here we go again. Welcome to Common Sense Wellness. I'm Dr. Gary Martin, and for 50 years, well, more than 50 now, I've helped people understand their health through testing, practical wellness strategies, and holistic approaches. On this show, we explore simple, actionable ways to restore balance, boost energy, and thrive. And today, I'm honored to be joined by Cho, right?
Yes.
Got it. I'm pausing because it's TSAO. And to me, if I was just going to look at that and say, it's Sao, right? But nope, it's Cho. I learned that this morning. Good.
Thank you.
Cho Lin Moy, a licensed acupuncturist, an herbalist, and massage therapist with over 24 years of experience in alternative and Chinese medicine. Cho is the founder of Integrative Healing Arts in New York City, where she blends acupuncture, herbal medicine, energy healing, and ancient wisdom, including Feng Shui and the Chinese zodiac, to support women's health, fertility, and longevity. She's the best-selling author of Will I Ever Get Pregnant? The Smart Woman's Guide to Get Pregnant Naturally Over 40. Yeah. And she's been featured on Dr. Oz, Good Day New York, and in outlets like Well and Good, Glamour, and WebMD. Yeah. And more recently, Cho has added breathwork facilitation and psychedelic-assisted therapy integration to a practice. Wow. Busy girl. Busy girl.
You got to keep on growing.
Bridging the ancient and the cutting edge. She's here today to share her wisdom on restoring balance and taking charge of your health. All right. Welcome to the show.
Thank you.
First question. You've built a practice that weaves together acupuncture, herbal medicine, energy healing, feng shui. Is that what you told me it was?
Feng shui.
Feng shui, right? And even psychedelic assisted therapy. How do you describe what you do to someone who has never heard of these things? How do you make it simple?
Make it simple is, how would you like to learn or experience your body's natural ability to heal, to really be connected to it and aware? So what I do, these are all tools that help people to connect to their inner healer, right? We have this ability to maintain balance or bring ourselves to balance, which would be homeostasis. And when we are all out of balance, that's when we get sick. And sometimes kind of getting sick is our body trying to get back into balance. But when we're not healing, then we're looking at something is off and we need to do something to support the body. And Chinese medicine really empowers people to connect to themselves, that body-mind connection, cultivating that interoception, that's that self-awareness, so that they can make informed choices about their health.
Yeah, we have a lot in common. Sorry, I'm filling my water glass.
Water's important, that's for sure.
Tell me about it. Number one health problem in America, you know that? It's the number one health problem in America. I believe it. Subclinical dehydration, they call it. Yeah. That's why the first thing they do when they check you in the ER is they hook you up to a bag of water, and
sometimes.
drip.
Sometimes.
All right. So,
Hopefully.
yeah. So this business about the body's self-healing nature is we have a lot in common, but that's definitely the basis is that the body is a self-healing organism. And so why isn't it healing? That's both your job and my job is to figure out why this person is in the situation that, why do they have symptoms, right? And so, the tools we use are different, but, that's the basic end. There's a resistance in the body that either the brain can't talk to the cell or the cells aren't talking to the brain in terms of fix the problem. Either the fix is not getting to the cells or the message that I need fixing is not getting to the brain. And both of our jobs is to figure that out. Pretty simple, but
It's simple, but it's not necessarily easy, right?
Tell me about it. Yeah.
The simple thing is, but humans tend to make things complicated and are able to, override their body's, signals, including, being dehydrated until someone, passes out or they get a headache and they may not even realize that they're not drinking enough water, right?
Yeah, I mean, it's certainly not taught in school, All right, so you specialize in women's health and fertility, and you wrote a book on getting pregnant naturally over 40. What is that conventional medicine often misses when it comes to women's reproductive health?
Well, there is a connection. I mean, women have a different, let's say, physiology and biology than men do. And so women's health is very cyclical, right? And actually all of us humans have that 24-hour clock. And this is something in Chinese medicine. We also look at like what time of day are your symptoms, and that may indicate what energy is being interrupted. And women, they have, their 24-hour cycle and they have a 28-day cycle. And then we also are affected by environment like seasons and a lot of stress. So what gets missed is if we look at ourselves as machines, which we're not, and expect everything to be even, we really miss the point. And oftentimes with women, there's so much about like that their fertility is really hormonal and biological, when the component of the stress, their emotions, other underlying conditions that may have been or oftentimes are overlooked because they go on hormonal birth control. And so what happens is that when it's time to, or let's say when a couple wants to conceive, then there are all of these other factors that were ignored, either with, pills, hormones, skin conditions. There's a lot of kind of like fixing symptoms without recognizing what may be going on and trending, whether it's, dietary sensitivities. I mean, environmentally, there's so many things that can interfere with fertility. And, even more is coming out about the male factor, that is very much a contributor to problems with conception, right? Because of the degradation of DNA and the exposure to like so many things like pesticides. So if someone is like on a golf course, there's so many chemicals that are in grass and coming off of the soil, and that ends up, there's exposure to that. And so we usually don't think of it. There's always this idea, there's something wrong with the female, but not so much. But it's a very stressful thing for women when they want to conceive and they're not, each month they're not getting pregnant. And that creates a cycle of stress. And that in turn makes it even more difficult, right? Because stress hormones are the biggest disruptor of reproductive hormones, like our sleep, all of those things. And in my book, I talk about that. I also talk about, and I teach my patients, is really what what is their cycle? Oftentimes it's not even taught in school, reproduction in a way that, how to measure when is your fertile window, and has nothing to do with education. Most of my patients are professionals. They're attorneys, they're architects, PhDs. But when it comes to recognizing what's happening in their body, that seems to be, they don't know that. And
Right.
I teach like really basic stuff. How can you track your cycle, with your temperature? You can use ovulation sticks. You can look at cervical mucus. You could check, like very subtle thing, even like saliva. You can look at the saliva, like there's the change in the protein of the saliva will also indicate, what hormones are kind of shifting. And important to really know your body. And this is, the other thing that I would say is that with all of these electronic, monitors, I'm very much against them. The Aura rings and the Fitbits and the Apple Watches that are kind of like telling you, oh, this is your temperature, this is how you slept. It's really not helpful for somebody who is just, trying to regulate and get a sense of where their balance point is, because there's something always monitoring them in a way that it doesn't really tell them like, well, this is what you can, these are like these areas that may be influencing. It's much more kind of critical.
You brought up something that was rolling around in my mind. Do you know if anybody's ever done any studies on golfers in terms of the diseases that they get or the cancers they get, or that might be out of the statistics would be higher than like,
I mean, for fertility?
Well, not necessarily fertility,
for
just in general.
Yes.
The whole exposure to all the pesticides and all that.
Parkinson's. Yeah, Parkinson's. They look at, the increase in, I believe it was Parkinson's and possibly Alzheimer's dementia, depending on how many miles that people were living near golf course, right? Because there's a lot of the runoff. And we know that things like, Roundup, which you might have to beep out of your podcast, we know that it is carcinogenic, right? There's so many things. And when you look at a golf course, they also use different kinds of dyes to make the grass really green and bright. And so we're looking at a lot of fertilizer and things like lawn care and watering, right? So then you have the water and then you have the ground, and then you also, that can like go into the water table.
All right. So your approach integrates ancient Eastern philosophy with Western science. In your experience, where do these two, in generally, making a generalization here, but where do these two worlds agree and where do they butt heads?
Well, okay, so where they agree is that stress is something that will interfere with your health, your nervous system, and actually more of that is coming out, and actually more about somatic therapies for mental health, right? That our body and mind are one. Our body, brain, mind are really one. And so with the Eastern philosophy, Eastern medicine, we're looking at, also India, Korea, all of it. In Japan, there are these ideas about your mindset, about calming, about breathing. So Western now is looking at more research with breath work in meditation for like lowering blood pressure, for relieving oxidative stress, for anxiety, post-traumatic stress disorders. So all of these things, which are practices, some of the branches that are in Chinese medicine are that mindfulness and meditation. And so this is where we can definitely agree on more recent studies with acupuncture, that the actual points that are, let's say, acupuncture points that are marked as related to certain organs, they can now look at scans of the brain and see that it actually, one point on the leg will light up a point in the brain that relates to the stomach, which is that stomach point. So they're actually kind of recognizing more of a correlation that's there, and that the benefits. So, recently I was at a somatic trauma healing intensive, and one of the presenters was Bessel van de Kolk. He's the author of The Body Keeps the Score, and a psychiatrist researcher. And one of the things that when he was presenting the slides, that he said, like, post September 11th, with the stress and anxiety, the things that really help people, it wasn't talk therapy for anxiety. And it was, number one, most effective was acupuncture. Number two, massage therapy. Number three was yoga practice. And number four, EMDR. Right? So there's and they were more somatically related. So where do we clash? We clash in terms of East Asian medicine looks at the whole picture of influence. More Western medicine is kind of looking at segments, not full systems. It's also much more, Western is more broken and fix model, intervention, whereas East Asian medicine, we're looking at, yes, you can treat the symptom, but you also need to address the root. So just taking medication doesn't really change the progression of a disease. So looking at lifestyle, like diet. And what I'd say that the sad part of, where the differences are is that in medical school, they don't really teach nutrition. They don't teach relaxation. They don't teach these things that, to identify that they can actually direct a patient to do on their own. And I forgot, it was an article, I forgot what article I read. It might have been in Medscape. And one of the things that was pretty sad is that, because there's maybe 10 or 15 minutes with each patient, number one, there isn't the time. The other thing, too, is that physicians often don't think the patient is going to do anything about it. And so they don't bother, right? They're kind of like, why would I, this person's probably not going to make those changes. And it's true. It's not easy to make shifts, but there's that, recognizing that the health of the patient or the person is really dependent on them taking action and recognizing how important their health is. So giving them the tools. So there's a big education portion in East Asian medicine of helping to guide and empower versus let me come in and, take over.
Yeah, you mentioned mind body there. One of the things that for 50 years I've been teaching people how to use this particular urine and saliva test. But back in the 80s, I think it was when we realized that when people would only get so well, you change the diet, you do a few supplements, you call attention to certain things, but our whole thing is converting everything to numbers. We are all about numbers. I want to know today you're here, you're at 59%. When you come back, I want you to be at least 69. And we have ways of, boiling all this amazing information that the body's going through, whatever, down into these numbers using this urine and saliva test. Well, back in the 80s, we found out that people would only get so well. And what was really holding them back, or this so-called glass ceiling, is the fact that your body is your mind made visible. So It's not the first domino, like you said, what goes on between the ears. So we had to devise a way to get inside of a person's mind, like we use urine and saliva to see inside their body. How can we get inside their mind? Well, we solved that, and we produced this thing that we call the memgram chart. And the memgram chart shows us what their source traumas were, how many there were. We can describe them. It's an amazing work. But I said all that to just say I agree with you in that you have to, there has to be mind changes. People have to get, I mean, no, I mean, people hate change. The body hates change. I mean, the body's really good at adapting, right? Is, helping you survive. Okay. All right. Well, you're going to live this way. Then I got to compensate. I got to do this and to make sure that, you can live longer. It really hates change. So it takes a few days of changing to have it even show up in this test we do, for example. First, the body kind of goes into shock. It's like, oh, what is she doing? Celery juice, oh my God, well, how am I going to deal with that? Or, whatever. All right. So
you're actually it's interesting, like the things that if you can connect the activity with the result and the feeling, then it's something that it creates that little dopamine, like when you achieve something. So for instance, let's say with exercise, right? Like it's like, oh, I don't want, people don't want to do it, or
I hate
boring.
Exercise.
Yeah,
Hate it.
Yeah. However, if you are getting a result, like that you're actually seeing results, that becomes a motivator. Right? Then
exactly.
It's like, and that's connecting the results. And that's like, I know when I do this, I feel better. And that's important for people to, regulate and know, like, oh, if I stay up all night long, I'm so tired, I drag. But then by nightfall, they forget and they want to watch the next
episode of something.
The episode,
yeah.
And then they're negotiating. Oh, just one more. Oh, I'll have 6 hours sleep. Oh, well, I'll be okay with 5.5. And then the next morning they're like, oh, why did I do that? It's like, it's almost like two different people, one at night and one at day. But when somebody can connect that they are doing something, and even like taking a supplement or drinking more water, and they can link their performance to like, oh, I feel so much better. I'm drinking water. I didn't get, that I remembered that, and I didn't have the recurring, the heat,
right.
Overheating or, that kind of a thing. So this is the part of that self-awareness. And then deeper, the interoception, right? The really deep piece. And when someone says, what is interoception? Okay, you actually do it all the time. When you're hungry, right? That's your body kind of like telling you we need energy, or you need to go to the bathroom. That's also you're aware of like your internal workings, or when you're tired, that it's telling you to rest. So different things. But then even at a much deeper level is that you can really connect and be like, oh, I shouldn't eat that. Like, I don't feel good when I eat that. And then that overrides the sugar craving. It just kind of like, yeah, but I don't feel good. Like, I don't feel good when I eat it. So I'm not really attracted to it the same way. That kind of without thinking, just grabbing for something. And so this is the educational and the self-aware portion.
Yeah, a lot of people, most people depend upon how they feel, right? Well, sometimes there's a really long time for some people between changing and feeling any different. And so you need something a little more sensitive in between to help give the person the feedback that, yes, keep doing this because you were 59 and now you're 62 and it's only been 3 days. And so your body is responding. You just don't feel it yet. Like that, which is what we use the urine and saliva test that we call the BIA. There's also a really
gratification portion.
Feedback. Like there's a really good tool that's available. We have it. It's also available on Amazon called the ORP meter, oxidation reduction potential meter, measuring the ORP of your urine. Where anytime you measure, you should always be below -20. If you're above -20, something in your life is prematurely aging you. Something's killing you. So just that little feedback, and it's a pretty sensitive test. You can say, if I ask you the question, if there's one thing that you think you might be eating or doing or thinking, breathing, whether you think that is not really doing you any good, what would that thing be? Yeah, and almost everybody's right, really. And they say, well, it could be this. I said, okay, well, Do it before ORP reading. Stop doing that for 2-3 days. Do your ORP for 3 consecutive days. If it consistently goes down toward that -20, then you were right. Stop doing that. You don't need to know why. Just stop doing that, because it's prematurely killing you, and that's why you don't feel good.
Yeah.
Okay, so you've worked with clients navigating IVF, IUI, and other assisted reproductive technologies. How does acupuncture and Chinese medicine complement rather than compete with those processes?
So it complements, because one thing that acupuncture does is it promotes, or it helps people to go into that parasympathetic nervous system. So that's the rest and digest.
All right.
When your body is in a state of fight or flight, in that survival, that it creates a lot of inflammation. And with inflammation, that works counter to reproduction. Right? So if you're the last thing your body is ready to take on is to, get pregnant and carry a baby. So together, with consistently having that where your body is working naturally, in a normal cycle, that this makes it easier to then, if, the couple or the individual is choosing to have more assistance, that their body will accept it, right? So it ends up being less stimulation with hormones, a lot easier, of the body accepting it versus fighting it. So when the body is in that state of fight or flight, and then you start to flood it with additional hormones, it can send off an alarm, and I've seen it. The women, they're very stressed out. I'm going through my next cycle. I need to do this. And they're given stimulants. And what happens is the body then overrides it. So instead of several follicles that are developing, in the end, it's just one. And they go, well, what happened? I was like, well, your body responded in a way that something's wrong. All of these hormones are flooding. I need to balance the other direction. And so with any kind of interventional type medicine that we would do, we really need to help to stabilize so that they can receive. Because sometimes, intervention is extremely challenging for the body. So let's say somebody who's, having heart surgery, you're fixing the thing, but the surgery in itself is extremely stressful and anxiety producing. My understanding is oftentimes they give antipsychotics, in recovery, because the experience can be extremely jarring. And so this is where the two work nicely together, right? To help the body to receive and then also to recover. So I had recently one of my patients, she broke her ankle. And healing, but actually falling down and breaking an ankle, it's there's like an emotional component, like why did it happen? Now it's going to take a long time to heal, interruption of life. And then also the body being like shaken up by actually breaking a limb and then going through surgery. So then the stress of I'm going to miss work and, so many other things which will impede the healing process. And then depending on, what the health was beforehand is also like, how's the nutrition? How's your sleep? Right? During sleep, we make growth hormone. So if you're not sleeping, then you're also interfering with, metabolic function. So this is something like acupuncture, meditation, breath work, all of those things are going to support the healing of the body.
So you were a senior clinical faculty member at Tri-State College of Acupuncture for 18 years. What is the most important thing you try to pass on to the next generation of practitioners about how to think about health?
Oh, it's interesting because I have the conversation a lot with colleagues, when they go, what's the point that's good for this and that? And I go, first of all, you need to look at the person who's in front of you. Don't look at the protocols. Don't look at points. Really look at the individual who's coming to you, not the condition. And so this was, so there's this idea, or there's a way of thinking, which not necessarily every Western medicine is like, where they say, oh, the cancer patient. Oh, they name the person based on a disease versus a person that has a disease. And so really we're looking the person who's in front of you. You've got to look at. And I would have these when I would do like cases, and at the end of clinic we would talk about difficult situations that would come up, and you're learning a practice, but then, like, for instance, one of the things would be pulse taking. And there might be a 70-year-old lady there, and, they're feeling her pulse, and and I'm like, okay, so there are pulses. When you look at the person, you're going to expect that their pulse is going to be because of their age. We know that after a certain period of time, a 60 or 70-year-old woman is not going to have the same pulse as a 20-year-old. And why she may have a similar complaint, we're looking at what does this person need? What is coming to you? This person needs to have their chi to be supported, right? A young person, maybe not the same. They're coming with they may have a shoulder injury, but they're going to heal a little differently than someone who's older. We have to look at their lifestyle. We have to look at a lot of other things and treat that, what is the root there, and then what is the branch for that person. And so the challenge was always like, who's in front of you? Who's that person? They're coming with their whole history there, right? What are they going to need? They're going to need to be heard. You need to listen, right? What's going to help them to heal? And we can't ignore the person-to-person experience, right? It's not the points. It's not just those. The treatment is part of it, but it's also that, connection to that person to be heard and understood and treated with respect. And so not like an interesting disease kind of a thing. So right. I think this is basically clinical or bedside manner, but really like honing into, this is human interpersonal connection and experience.
Right. All this takes time, and it certainly takes more than 15 minutes, and that's one of the biggest differences between your approach and my approach, and of course the traditional medical thing. So with all your success across so many modalities, what would you say is your biggest challenge right now?
Well,
what are you personally challenged by?
Well, I think, the challenge is that, people they really want a quick fix. And I think it's that I would say hallucinated. We've been hypnotized into the idea that we have plenty of time, we can take care of it later. Oh, if my knee busts, I can always get a replacement. So there's this aspect of not...
Don't upset the apple cart.
What do you mean? Not to the...
From their standpoint, they're looking at it as, change.
If it's not broken, then don't fix it. So there's a lot of the, why would I, and some of it is well, I don't feel sick. Why would I come for acupuncture? I'm not bad enough, and it's kind of
right.
We want to get in front of it. We don't want to be, trying to crawl or climb our way back to just stability, because that's not fully healed. Just stable does not mean you're fully healed. And so those are some of the ideas of, people go back to work before they're really fully well. And because they're running all the time, that they're already at a deficit, at a health deficit. And so this is something that, everything's so fast and like energy drinks and power and not really recognizing how important recovery is. And that I see a lot. I see, people, I have an injury, but I want to get back to the gym and do what I was doing. And I'm like, but you understand what you were doing is why you're in my office.
Yeah.
You're going to need to modify that. Yeah.
Yeah.
So there's a lack.
Change. Oh.
Yeah, change is like, but it's really a modification. It's maturity. It's working faster. I mean, not faster, but more efficiently. It's like satisfaction. People also compare themselves. I'd say influencers are, I don't say the bane, but there's so many people that have no degrees, no license, that are giving information which is like erroneous. And so I find that can be very challenging, because it's also it's just like little tidbits, and people like what they're hearing, and then they go off and they do something, and so there's that. And I think there's like a unconsciousness, I think, is the big piece of and not valuing themselves in a way.
So where can our audience go to learn more about you and your work?
Well, I have a website, which is arts.com. I also am on Instagram, which would be Integrative Healing Arts NYC. And I guess you're going to post it also in the show notes.
Right.
Yeah, I'm also on LinkedIn. So
you are definitely somebody that I think that's many people in our audience are going to want to follow up with and find more about.
Well, I hope so. We have the capacity to heal, and it's really, that the other thing too is that oftentimes people feel disempowered, when they go to their physician, or they don't even have a primary physician, and so they're kind of they tell them, oh, you're old, or this is normal because you're old, and I'm like, it's not true, it's kind of like, there's some things, but it's not all true, and you can really change your health. You can really upgrade yourself. You can really heal yourself. It's just, and the time would be now. Every time, like now is always the time to start doing something. And little bit at a time, because otherwise people give up.
Exactly.
Yeah. So it could be just drinking an extra glass of water, right?
Right. Drip, 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 little by little, a lot of times during the day.
Yeah.
Emulate what they, when you walk in the ER, they already know you're subclinical dehydrated. It's the number one health problem in America, but they don't hand you a 16-ounce glass of water and say, here, chug a lug. You are dehydrated. They know that the body works more efficiently if it gets a little bit more at a time. So they hook you up to a bag of water, drip, drip. All right. Well, Jolynn, thank you for joining us on Common Sense Wellness. Remember, taking practical steps to understand your health emotionally and physically is how we restore balance, boost energy, and thrive. Thank you to Jolynn, and we'll see you next episode.
Thank you.
Bye-bye.
Thanks for listening to Common Sense Wellness with Dr. Gary Martin. To learn more about the testing and resources we discussed, or to find out how you can take charge of your own health, visit BIRI.org. You'll find valuable information, free tools, and ways to connect directly with our wellness community. That's BIRI.org. If you enjoyed today's episode, be sure to subscribe and share the show with someone who's ready to take their next step toward better health.